To go into the NHS, you want to make a difference. So I think that's the first thing. None of us would be here if we didn't want to make a difference to people's lives. And being an NHS organisation, we very much focus on quality and patient safety.
I believe that leadership is not just about talking. Leadership is also about doing. It's about understanding what the colleagues are going through. There's something about, in my role as a chief nurse, actually how do I also put myself in the shoes of people who are delivering services. With the nursing leadership, I think we've agreed that from beginning of April, we will all do one day every 2 weeks in work, which I'm already doing, but actually all of us, the 14 people who are in that nursing leadership, there will be an expectation that actually they are all doing a clinical day somewhere. But doing that, I think it's always good really to walk the floor. Actually, you hear much more, but also it gives you an opportunity to get some of those feedback which you normally don't get.
For us, engagement and co-production is absolutely a minimum requirement that we need to be doing, and that's everything from caring at the front lines, so involving patients in their care, so individualised care planning, because you know what you would want, from supporting in service developments, supporting in wider strategic developments. So as you may know, we have patients on boards now, so they can really be active participants and challenge appropriately. And in many of our teams now we have, and meetings, we have service users, carers or families, because they're really important in gaining their voice and shaping what's now, what's in the future, what needs to be improved and what's going really well.
So as an organisation, we're doing a lot of work around co-production. So we're doing a lot of work making sure that the voice of the service users and our patients is being heard. So we do a lot around 5x5, which is really getting feedback from service users directly. In our inpatient wards, we're working with colleagues like Mind, which is a voluntary sector, which does a lot of work with us around getting the voice of service users also. And at the point of discharge, we also ask how their experience has been. And we're also working in our community colleagues to make sure that actually every contact counts, that actually when we contact our service users, we're asking that very important question, what matters for them and how can we make a difference for them?
So in NELFT we have almost 7,000 people, colleagues within working within NELFT and looking after a lot of people, and within that they need their own health and well-being supported.
There's always this concept that if those who deliver care are not cared for, what type of care would they deliver? So as an organisation, we really understand the importance of really putting our people first as a core value of the organisation. For us to be able to put our service user first, we need to make sure that actually the staff who are delivering those services are also put first, fundamental in everything we do.
So we very much have a strategy around that to make sure whoever you are in NELFT, there is something for you, something where you can go to, whether that's a staff network. There's a variety of staff networks, and some have been internationally renowned, and we're well ahead of some of those areas. We've got ambassadors locally who support on the ground for staff. We've got a variety of initiatives every week through our comms plan to engage within activities. We've got signposting to Wellington in North East London, where it's a confidential service to support staff to be able to, for them to go in a confidential space to speak to a professional about any concerns they have, and they might signpost them.
We've been on a journey as an organisation over the last 2 years, and we continue to build on that as we move on our journey to outstanding, not just outstanding for CQC, but outstanding experience for everyone who comes in touch with us.